Thank you, Dr. Shelley, for talking with us today. April is C-Section Awareness Month, and we wanted to get a little bit of information from you about what a C-section is, what to expect if you have to have a C-section, and maybe what would be some of the signs that a person would know that they're going to need to have a C-section.
Okay. Well, we're fortunate here that all three of the family physicians that we have at Gove County Medical Center can perform cesarean sections. We all do OB and all have the ability to do a C-section ourselves if that were to be needed. C-sections are needed for basically two reasons. One, the baby is in distress and we need to expedite delivery. Well, three actually. Two would be mom is in distress and we need to expedite delivery for her sake. And then three would be we're just not getting anywhere. The baby is stuck, for lack of a better word, either because the baby's too big, in a position facing up or facing sort of cattywampus, for lack of a better word, just not fitting in there correctly. Or perhaps just the shape of mom's pelvis doesn't allow for the baby to come out vaginally. So a C-section is indicated in that instance as well. How long we wait to do a C-section depends on the situation. If baby's tolerating labor well and everything looks good and mom is tolerating labor well, you can allow slow progress to occur. If baby's showing signs of distress or mom's blood pressure is elevated or there's some reason, that we're concerned, then we may be more likely to proceed with the C-section more quickly. There's some signs before, some indicators before labor that, we can kind of tell based on the size of the baby sometimes, or maybe the angle of mom's pelvic bones and things like that, whether or not there's a higher risk of a C-section. So that can kind of determine how long we let someone labor before going to C-section as well. But we'll watch heart tones and we'll watch the progress of dilation and the baby descending. There's different things that you monitor for the progress of labor, and then we can either, if we have to do a C-section very quickly, we can certainly do that, but we prefer to be a little proactive and anticipate what's going to happen as best we can, and then move to a C-section in a controlled manner. So.
And what would a mom expect after delivery for herself and for the baby?
Well, we in the last couple of years have become a baby-friendly hospital. So we try, which means that we really try to promote skin-to-skin contact right away with the baby. And so instead of baby hanging out in the warmer for a while mom is on the table finishing the C-section, we'll get baby right up on mom as long as everything's okay. So I guess I should clarify that unless it's a real emergency section, mom is going to be awake during a cesarean section and aware of what's going on, and so that's kind of neat. And able to talk to us and see and hear their baby right away, which is pretty cool. And then we'll get baby to mom right away up on her chest, and then dad's right there usually too, which is nice. So, and that can happen. We can keep babe on mom, as long as baby's doing fine and mom is doing fine while we finish everything, and baby stays with mom during the recovery and all that. Our nurse anesthetist, Brad Wertz, is the one that we usually have here, and he does an excellent job with anesthesia and doing a long-acting pain medication in the either spinal or epidural, so that kind of carries on for the first 24 hours so that we can get moms up and moving a little bit without hurting. And we have pain medication available, obviously to control the pain, and we try to be proactive with all of that and get everybody up and moving and recovering and doing all those things as quickly as possible. So.
Okay. Is there anything else you can think of that you'd like to add?
Well, I feel very fortunate that we're able to do real comprehensive OB care. Some smaller hospitals aren't able to do cesarean sections for whatever reason, surgical crew, anesthesia, enough physicians who have the surgical skills, and we're lucky enough to have 3 of us. Then we will have 2 new physicians joining us in 2019 who will also have those skills. So there'll be 5 of us that will be able to perform C-sections in full spectrum OB, which is really really neat service for our patients. So
Okay, well, thank you very much.
thank you.